Good afternoon, everyone. Today we are going to study about the most important topic of medicine one, that is pneumothorax. So first I'll start with the definition. Pneumothorax is a condition in which air is present in the pleural cavity, leading to partial or complete collapse of the lungs. Okay, and this mainly the lungs are affected. The air is accumulated in the pleural cavity of the lungs. So the types of pneumothorax are the types are mainly classified into three types: spontaneous pneumothorax, okay, traumatic pneumothorax, and tension pneumothorax. Spontaneous pneumothorax again divided into primary pneumothorax and secondary pneumothorax. Okay, if three of these occur simultaneously, it can develop into the tension pneumothorax. Tension pneumothorax is an emergency and life-threatening condition. Now we are going to discuss in detail about the types of pneumothorax. Spontaneous pneumothorax occurs without any external injury. This occurs without any external injury. This can be divided into two types. Primary spontaneous pneumothorax occurs in healthy individuals, okay, and no underlying lung disease. Common in young, tall, thin males and smokers, okay. And secondary spontaneous pneumothorax occurs in patients with pre-existing lung disease. Pre-existing lung disease can be the chronic lung diseases. Common causes are COPD, tuberculosis, asthma, or lung cancer. As you can appreciate in the diagram, this is the healthy lung, okay, and this, sorry, I'm sorry. And this, in this, you can appreciate the pleura in the pneumothorax. Okay, the lung is damaged, it's collapsed. Second is the traumatic pneumothorax, occurs due to chest injury, causes RTA, okay, step wounds by the sharp objects or the knife, and the refractures. Tension pneumothorax. As I told you earlier, this is the life-threatening conditions, and this air enters the pleural cavity but cannot escape. So that's the reason it's a life-threatening condition. Causes can be valve mechanism at pleural defect. Air can go inside the chest but cannot come out. Right? Causes: etiology, rupture of subpleural valve, COPD or tuberculosis, chest trauma, which can be caused by RTA, refractures, stab or gunshots. So what is subpleural valve? Small air-filled bubble on the outer surface of the lung, just under the pleura. Okay. Clinical features of pneumothorax. Symptoms and signs: sudden chest pain, sudden breathlessness, reduced chest movement, hyperresonant percussion. This can be done on palpation, reduced and absent breath sounds, okay, and tracheal shift. The other signs and symptoms are severe dyspnea, hypotension, and tracheal deviation. Investigation: chest X-ray, visible pleural line with absent lung markings. CT chest. What is CT chest? Computed tomography scan of the chest. Okay. It is an imaging test that uses X-ray and a computer to produce detailed cross-section image of the lung and the chest. Just remember this, the cross-section image of the lung. Okay. It helps produce cross-section image of the lung and the chest. And why it is important? It helps to see small lung problems that are not visible on X-ray. These are mainly done after the X-ray to detect bulbs or to assess lung diseases, tumors, or infections. Now we'll come to the management of pneumothorax. So the management can be divided into according to the types of the pneumothorax. So first is the small pneumothorax. In this, less than 20% of lung is collapsed. Patient is stable. So in this, management is oxygen therapy. Oxygen therapy is given so that it helps air in the pleural cavity gets absorbed faster. Okay. Observation and rest and repeated chest X-ray every several hours. Second is the large pneumothorax. In this, more than 20 to 30% of lung is collapsed. These are the symptomatic patients, and the management is intercostal chest drain. Intercostal chest drain. I'm sorry. Intercostal chest drain insertion. Drain allows trapped air to escape continuously. Lung gradually re-expands. Okay. So what is intercostal chest drain insertion? This is the medical practice. This is in this usually inserted. ICD is usually inserted in fifth intercostal space or mid-axillary line. Okay. Third is the tension pneumothorax. This is the life-threatening and emergency condition. Immediate management is done. So the first one is the needle decompression. Large bore needle is inserted in the second intercostal space and mid-clavicular line. Okay, just remember this. Needle decompression is done in second intercostal space, mid-clavicular line, and ICD is done in fifth intercostal space, mid-axillary. Okay, followed by intercostal chest tube insertion, and the complications of pneumothorax are respiratory failure, tension pneumothorax, and recurrence. So this is how we have done with the pneumothorax. Pneumothorax is mainly asked for the 7 marks in MUHS University. So for detailed PDF of the lecture, you can DM me on Insta or the WhatsApp community. The links are provided in the description.